Keisha. I'm a registered nurse. I walk. I used to walk 3 to 4 miles a week, just being healthy, exercise because I do have high blood pressure. So that was one of the things that I did. Walk. I walk for exercise. So during that time, walking, it happened about 2 years ago. I started with some lower leg pain, and I still continued to walk because I thought maybe I didn't maybe have enough potassium or something. So I continued walking, and then eventually the pain um, went up the leg to my hip and my lower back. And then at that point, I went to the chiropractor. Um, so after I did the chiropractor, basically we got to a point where he couldn't really do anything else for me. So my next treatment option was physical therapy. I did physical therapy for several weeks, and again, no relief from my pain. Um, the pain, it radiated down my legs, the back of both of my legs, and when I went for my physical exam in November of 23, I told my doctor, I'm still having this lower back pain. Like, I'm not sleeping. It's difficult to do my chores at home. Difficult to work because I am a nurse. I stand probably on my feet 12 to 14 hours some days. So from there, she says, well, I have a doctor to send you to. So she gave me the number for Orthopaedic Spine Center. And I made the phone call. I think I started coming around January of this year. I spoke with Dr. Carlson, and he gave me a plan. And we did, again, start with another cortisone shot, hoping that would relieve some of the pain. And it did. And so he said, surgery is, your best option. We did an MRI. He explained everything to me from beginning to end. From there, we talked again before the surgery, and he told me that, he says, when you wake up, you won't have any more pain. And sure enough, he was right. I went for my follow-up appointments and still no pain. I did the physical therapy, still no pain. I was able to walk up and down the stairs the next day, and just with the help of the walker and cane and all those things. It was a really an amazing experience. For 2 years I suffered with that pain, and then for him to come in, and I was in tears when I saw him at my follow-up visit, and I gave him a big hug, and I was just so thankful, so grateful that I was able to do the things I still have a daughter in high school. She's in the marching band, so during the fall we travel a lot, between competitions, assessments, games. So there's a lot of travel, and helping with the kids walking, and even sometimes pushing equipment. So it was I was taking pain pills and things just to get through those games and everything. And so I am just so grateful. Even everybody's like saying, oh my God, you don't look like you had back surgery, and I don't. I did all the things I was told to do. I wore my back brace. I did my exercises, and so I felt like it was a miracle.
That's